Hi, and welcome back to Dr. C's Morning Minute. Glad you could be here. Starting a series on the facts and fallacies on ADHD. The first has to do with how ADHD is diagnosed. I often get a question as to whether or not there is a specific ADHD test. There's not. There's a protocol that we tend to use that has to do with ADHD, the core symptoms being evidenced over the course of really years and specifically before 7 years of age. That these core symptoms are getting in the way and they're seen in multiple settings, home, school, and community. That there is not a better explanation for those core symptoms of distractibility, impulsivity, and hyperactivity. Or sometimes there's obviously different types of attention deficits that could just include just distractibility, not necessarily hyperactivity. But either way, there needs to be those core symptoms over the course of time, multiple settings getting in the way. And if it runs in the family, that's even more compelling. Now, in terms of diagnosis, we often rely on different sources. And this is an interesting point in terms of whether or not teachers are a reliable resource. Teachers walk a fine line. They're in a very tough situation. Clearly, if there's an issue, they want the parent to know that the child's having difficulties, that their child is having problems with distractibility and whatnot, and getting their classwork done in a timely fashion. But they don't want to come across as diagnosing the kiddo. And so sometimes there's a reluctance to be straightforward about what they're seeing in the classroom. What we find, though, is that teachers are, in fact, a very, very reliable resource. I'll get a sense that if teachers are speaking up, that then they are seen as, again, diagnosing or unreliable or things of that nature. But in fact, keeping in mind that teachers, especially experienced ones, have seen dozens and dozens and dozens of students over the course of years, and they really have a really good idea of what is typical in terms of expectations for a kiddo being on task and getting their work done in a timely fashion compared to other kiddos. And so if they see one particular student that seems to be outside those parameters, they are really good at picking up on that and then being able to convey that in a compelling fashion to help make or not make the diagnosis. And again, though, also to help explain, possibly come up with explanations for other issues that may be getting in the way, including, for example, reading issues. So those are two aspects, these are facts and fallacies about ADHD. There's others on the way. See you next time, Dr. C's Morning Minute.